So tonight I'm going to talk about three things. First of all, I'm going to talk about the heart in Chinese medicine and what the heart means from a Chinese medicine. Oh, you are muted. Okay. Have I been muted all this time? Seems like I didn't unmute myself when I started.
No, you have not been muted. We have heard everything.
Okay, great. Thanks. So I'm going to talk about the heart first. And then there's been a tremendous amount of information coming out of like, well, this is a flu. It's not so serious. Let's look at everybody who's, passed away, and why are we giving this medicine so much credence? And so I'm going to address that secondly. And I've really spent a lot of time studying and looking at COVID this week. And with my amazing assistant, Jennifer, have been able to spend some time defining COVID from a Chinese medicine perspective in a little bit better way. And what I want to point out to you is now that the CDC and everyone seems to feel that this is going to be something here for a couple of years at its worst, and we're going to go through peaks and valleys in this, that, what does it take for us to move through this and survive this over a period of years? I think we've all been thinking about this initial time when we've been confined from work or confined to our homes, and I don't think that gives the real picture. So I'm going to be doing that during this time. I'm also going to turn so I can have a little bit better light here. Great, thanks. I don't know who I'm thanking, but I thanked someone. So I want to talk a little bit about the heart in Chinese medicine, because in the Chinese word for heart is actually the word Xin, and that would be pronounced Shin. That would be pronounced Shin if I spoke Chinese well enough to pronounce it correctly, which if my nephew's listening, he would be laughing. So I'm going to refer to it as Sheen tonight, because Sheen, whenever you hear me say the word Sheen, I just want you to translate that into heart, because there's also the word Shin that has to do with our spirit. And the sheen of the heart is not exactly the same thing as the shin of our spirit. So we have to look at, I just wanted to clarify the pronunciation, because if I was saying them, I'd be saying Xin as shin, and then I'd be saying Shen as shin. So it sounds like the same thing. In the Chinese language, all of the organ systems have both a physical, a spiritual, and emotional aspects, okay? But if you look at the heart character in the Chinese language, it does not have the radical that means flesh or that has to do with substance. So from just looking at the Chinese language, we would look on the heart, that they talk about here as not having substance. So not being truly the cardiac organ we talk about. In Chinese medicine, the heart, or Shin, means actually heart and mind. And we don't look on the brain as in Chinese medicine as what controls and creates our heart. Creates our thought processes. It's not the brain that does that. The brain's really more like the library, and the ability to put things into that library, to pull them out, to look at them, evaluate them, and to make inferences based on what we know. All of that mental faculties really is the heart. The brain's just a storage library. And so whenever we talk about the heart, it's really talking about something that's immaterial. It's the spiritual and emotional components of the heart that are primary, not actually, it's not really the physical cardiac organ that we talk about within Chinese medicine. And so if we're talking about the heart, what we're actually talking about is compassion, our clarity of intentions, and our clarity of our mental faculties. And that is what heart qi is in Chinese medicine. Okay, it's not that it doesn't circulate the blood, but the biggest factor of the heart in Chinese medicine is our mind and how our mind is functioning and how it's processing information. So I want to just tell you a little bit about that. And the reason I wanted to go into that is because it has a lot to do right now with what they're seeing from a Western perspective, having to do with COVID and what's going on. So I'm going to do like a 10-minute review of what we're seeing right now happening in the world with COVID. It was January 23rd that they closed down Wuhan. And it was really around the 1st of March that we all became really cognizant of, oh, wait, this is going to impact us too. This is not just for, China. There's all kinds of theories going through not mainstream media, or maybe some of it through mainstream media, about how this originated. I don't know that that's the most important thing right now. It's for us to look at where we're going to go. They closed Wuhan for 10 weeks and it's just started opening back up. And we as Americans are kind of at the end of our ropes because we've been closed for 4 weeks. And that's pretty understandable. Right now at this point, it seems that they're saying, or I guess this was back around the end of March, that China had a 4% mortality rate. Italy, 10% of the people who have basically contracted the COVID virus have passed away. Iran, 7%, Germany, less than 1%, and the USA, about 1.5%. Part of the issue with looking at this epidemic is that there's people are saying, oh, it's the same. We've had flus before. But a seasonal flu that we've seen in the past, it has a figure, it says 1.3 naught, an R naught figure. What that means is that for every one person who has the flu, that they've infected 1.3 people. So it's less than 1.5 persons for each person who has the flu. So if you have it in your home and you have a family of 4, it's likely that one other person will get it, but the other 2 most likely not. The mortality rate for the seasonal flu is 1 person out of 1,000. Okay. What they're seeing right now, and what JAMA, the Journal of the American Medical Association, has just pointed out, is that this flu is much more infectious. It has an R0 figure of 2.4. So whereas if you had a family of 4, one person may have gotten the seasonal flu, at least 2 of the other 3 people in your family would catch the coronavirus, and maybe, it's 2.4 rather than 1.3. So it's much more contagious. And unfortunately, it's 10 times more deadly. And that's one of the things I'm going to talk about from a Chinese medicine perspective, because from a Western perspective, I think looking at it now, I have a deeper understanding. We've looked, in looking at other big epidemics, The SARS had or not of about the same thing as this, somewhere between 2.5, and they've said it could have been a little bit higher, but the mortality on that one was 10%. And the Ebola, the mortality on that one is 50%. But in looking at this, the problem with COVID-19 versus the seasonal flu is that right now, to survive COVID-19, the 5% of the people who get it become critically ill. And a high percentage of those critically ill people have to be on respirators. And if we don't have access to respirators, those people have less of a chance of survival. So, you know, that's one thing. It's been a greater burden on hospitals. And that the fact that it is more easily caught, it's more infectious, is showing up in our healthcare personnel. Our healthcare personnel are having a much higher rate of basically catching this flu and then passing away. It's much higher than any of the other epidemics. It's higher than SARS, it's higher than Ebola, and how much of that is due to not having all of the proper gear to be able to absolutely change your respirator from one patient to the next. But we do know that this greater burden on the hospitals is going to impact it because it's much more contagious. In looking at, gotta find my notes. In looking at this illness, what we continue to know is that at the very first week, it's going to impact what we often know as just a general respiratory virus. You're going to have a fever. You're going to have a cough, but this time the cough may be different. It may not be as much of a wet cough, and it's going to be a dry cough, sore throat, headache, body ache. All of those are pretty much the same that we have, you know, with the regular flu. In Chinese medicine, we can say a regular flu can bypass the lungs and go straight to the stomach. So you could have a stomach virus instead of respiratory symptomology. And if we look on the cells of a lung, and at each one of the, if we look at the lungs as being like a respiratory tree, at the end of each one of those, you have your tiny air sacs, the alveoli. And the problem here is it's just a single layer of cells, and the little sacs that should be full of oxygen are showing up as white. If they were full of oxygen, they'd be black on the scans and x-rays they were doing, but they're showing up as white. And so that's, you know, dead cells. That's basically mucus. It's many things that are blocking those air sacs. And, you know, some of the people who are getting this, those who are maybe not the most serious, are doing okay with just some oxygen support. You know, you see people walking around with the oxygen tanks, and they're able to do well with just that. The ones who are not doing well, from a Chinese medicine perspective now, I've started looking at this to see what is happening, you know, because it is going beyond the lungs, okay? And I think in my very first talk, I talked about how the lungs have to descend their energy to the kidneys. And to do that, the diaphragm has to be open. And if the diaphragm is blocked here, okay, then the lung is not able to descend very well. what tends to be happening is in Chinese medicine, we're seeing that a lot of the symptoms that if you look at why people are dying relate more to the liver qi than to the lung or the heart. But what they're seeing is a lot of what they consider cardiac symptomology. Okay. Just for, let me review a little bit. In hospitalized patients, 50% of the people who pass away, they see that the liver enzymes are really elevated. Okay. Another big group of them, they end up having blood clotting anomalies. And this blood clotting anomaly that they're looking at as maybe being some type of circulatory issue in Chinese medicine would be defined by the liver. The liver qi that I first talked about that first day that has to circulate freely through the body. And I recommended walking to help improve the liver qi, not walking really, really fast, but to have a relaxing stroll. And that's almost by doing a stroll, it creates some type of where your mind is totally relaxed. You're not sitting there working the whole time you're walking, but you may even be walking with a friend and it's a relaxing. But that liver, walking gently is what we feel is assisting in keeping people healthier. The other thing is with this clotting, if the liver qi is moving, then it moves blood. And if the blood is not moving, oftentimes that's due to liver blood stagnation. And so you can have clotting anomalies, but in Chinese medicine, that's from the impact of the liver. You can have blood, they're seeing people dying of strokes, they're seeing people die of pulmonary embolisms. Basically, all of these things have to do with blood constriction. And that circulation of blood relates more to the liver than to heart disease. I've often told my patients that heart attacks in Chinese medicine don't come from having, a weak heart. I mean, that would be that heart attacks come from blockages, and those blockages come from the liver qi, whether it's qi stagnation or blood stagnation. And so in looking at what they're seeing as the cardiac issues that are coming up from a Chinese medicine perspective, we would be looking on those as due to the liver rather than due to heart qi disorders. And that's why I started by talking about heart qi as being not so much associated with the organ, but having to do with our spirit, our emotional connections, our spiritual connection to ourself. The other thing is we know that the lungs are connected to our sense of smell, okay? The lungs, we say in Chinese medicine, open into the nose. That's where we take our long, slow, deep breaths from. We know that right now they're starting to see issues with the eyes. And in fact, conjunctivitis is something that many of these people are experiencing. In Chinese medicine, the liver meridian opens into the eyes. So the eyes are also associated with the liver from a Chinese medicine perspective. And so what they're starting to see is that many of these people, the people that we thought might be having the biggest problem would be those with lung issues, But what we're seeing is diabetes. And diabetes is a vascular issue, age-related, where we know that blood circulation is not as good, and high blood pressure. All of these three groups of people all tend to also have some issues with the liver. The pancreas is oftentimes can be impacted on by liver. That's why people who have diabetes at a certain point oftentimes will see that, oh, my blood sugar being off this time really wasn't about what I ate, but it had to do with my stress level and the tension that they were carrying. So high blood pressure, sometimes, again, from a Chinese medicine perspective, we're treating the liver for hypertension rather than the heart meridian. And that's because, these are related more to vascular circulatory issues, and the circulation of blood is based on the circulation of qi. When I talked that first day, again, we talked about the lungs descending its energy to the kidneys, okay? And then, that the diaphragm was imported there. So in reviewing those things that are creating problems, they're seeing that it's not a lot of people with asthma that are being more predisposed here, but it really is more people who are having vascular problems, because people are oftentimes ending up with seizures, they're ending up with strokes, they're ending up with pulmonary embolism, which is a blood clot actually at the lungs. So these are the things that are basically creating the illness. And the illness started with the lungs, but once it progresses, it's moving in areas that are impacted by the liver qi in Chinese medicine, or what's ending up. So I lost my note I'm looking for page 4. Maybe I don't have it. Here's my page 4. So from a Chinese medicine perspective, looking at this from a physical component, what you want to continue to look at is the health of your liver qi, because all of us get exposed to viruses. And, in that first week, this virus, you have that first week when you're first experiencing those symptoms. I guess it's one of the reasons we've stayed open at the Chinese Acupuncture Clinic. By the time somebody is in that severe place, they're going to need a respirator. They're going to need Western medicine. But in that first week, when people are experiencing flu symptomology, my belief is if we intercede at that point, then they won't, hopefully we can prevent people from moving into the more severe stages where it bypasses the lung and moves into the liver and starts creating this whole growth of symptoms that would end up impacting the liver and then all of the organs of the body. So that's why we're open. That's why we've stayed open. In looking at the things to do here, this is a time where it might be easier to have a little bit more alcohol because you're just at home enjoying that, but it might be a time, to basically choose to drink less than to drink more right now. The other thing I'm going to continue to say, I think I said at first to get out and take an hourly stroll. Now that I've been looking at the types of things that are actually taking people's lives, I'm going to suggest that you maybe go out and walk 2 hours a day. If you're not in a situation where you're having to work, you've got plenty of time, okay? And so many of us are out of work at this point in time. I really, really recommend that. The other thing besides the walking is basically relaxing your spirit. And so I'm going to talk a little bit more about the heart in just a second. But the best thing for the liver is to have free flowing of your chi. And that has to do with having an open heart and a relaxed mind. So we are going to talk about the heart and how it can impact here. But again, I think liver is paramount. So, eating a clean diet, that's good. It's always good. But the most important thing now is to do gentle exercise. I mean, you could be doing, I would not suggest the yoga, that's the one that's so difficult that you walk out having sweat a tremendous amount, or the hot yoga, but relaxing, stretching yoga, Tai Chi, Qigong, all of these things that help to calm our minds are really important exercises at this point for the health of the liver. So, those three things, Tai Chi, Qigong, yoga, I believe are all really important. Okay. I've seen two questions I'm going to answer in a few minutes, one of them. But another thing that's been pointed out to me is that just the act of singing and, usually when we're singing, you can almost feel how it opens up your heart. But it also relaxes the diaphragm, because you have to have, you can't have a tight diaphragm really and be singing. And, so singing might be another thing that you could do. But that was just thrown out to me to recommend that. But again, gentle exercise. It's not going out and running a marathon. That in Chinese medicine can be, that weakens the heart chi. And so that's an over exercising. So go out and do a gentle stroll for 2 hours with some, with your husband, wife, or partner, where you can really just sit and be together enjoying life. Or take your children out. Do bike rides, anything where you can go out. I had someone come out to my land this weekend because I found out all the national parks were closed, and my land backs up to Christ Mount in Black Mountain. So maybe there'll be a lot of people in Christ Mount next week. Anyway, so okay, here I am back to page 4. So in looking at the heart, I already mentioned that the heart, we don't look on as having as much of a, the heart chi is attached to what we think and our spirit and our emotional and our spiritual connection into our mental activities. It's also a reflection of one's overall vitality. In the Chinese religion, the heart is referred to as the empress or the emperor, and the heart should be a quiet and empty vessel. I told you already, it opens into the tongue. So if someone loses their sense of taste and their sense of smell, we know that the COVID-19 is already impacting their lungs and their heart chi. We also know that the nose opens, the lung opens into the nose, the liver, the eyes, and the heart, the tongue. So all three of those systems are closely aligned with COVID-19. But from a Chinese medicine perspective, blood circulation relies on free and easy liver qi. There's a pill called Free and Relaxed Wanderer. I guess what I'm recommending for us now is that all of us need to have that sign, that feeling that we're a free and easy wanderer in this world right now, because that would show the ability of the liver to be able to adjust and move and to be, again, free and easy. So there are pills called Relaxed Wanderer or Free and Easy Wanderer. This, from a heart perspective, if we look at the heart that I talked about earlier as not really being associated with the organ, the heart in Chinese medicine is associated with compassion and clarity of intention. And so one of the things I'm going to really recommend is that we all focus on our liver for being healthy as far as our physical body. But we know that the biggest impact of our body and its health comes from the mind. And the mind is the heart in Chinese medicine. So the more we can have an empty vessel of our heart, in other words, not be judging everyone that we are looking at and thinking, what are you doing? I was in the Ingalls in Black Mountain today and looking around and thinking, oh my goodness, like no one around here is wearing a mask. There were so few of us. But, I realized that even those little things, I don't want to be in a situation where I want to expose myself a lot with people who are not being more proactive in taking care of themselves. But, it's so easy for us to, judge others. And I've already heard from a number of patients, if they already have a lung issue or if they have anxiety, it's almost impossible for them to breathe with a mask. So I've been looking at people now and trying to just say, okay, they've, need to be without a mask because they're not able to breathe right now. Because we know that, that mask is unfortunately not really protecting that person, is protecting us. So as long as we're wearing as good of a mask as possible, that's going to be the best thing to do. But I think, in looking at this, the heart again is the emperor and the liver is the general. And so we need to have a good balance right now between our heart and our liver energy. And we need to get the general out moving and walking through the neighborhood, but walking without judgment and walking, with clarity of intention that we're going to all take care of ourselves and each other as much as possible. So that was really all I wanted to talk about today, because we are hearing a lot of people saying that, well, we don't really need to be doing this. It's time to go back. And Wuhan was closed for 6 weeks. And like I've said, it's been 10 weeks, and it's been barely 4 weeks for us. So I'm like everybody else, just saying prayers that if we open back up soon, that, something will happen and we will have stayed away from each other long enough to create this flaring up again. But we do know that it is more contagious. So in your home, remember that, one person in your home gets it, probably 2 others are going to get it also. So we all need to take care of ourselves and also each other. So if you have any questions, one person has already sent a question asking if they're acupuncture should be wearing a mask at this time. Well, I don't know about that acupuncturist. I know in my office, all of us are wearing masks, and we're not just wearing any mask, but we're wearing the N95s in my office. We now ask every patient who steps into our office to put on a mask when they're out in the public areas. Once in a room, I let them take it off so they can relax during their treatment. But that's one of the things that I'm doing at this point in time. So I can't really say about your acupuncturist. So as far as someone's asking about what we can do to help bolster our heart and liver, the heart has to do with calming our spirit and calming our heart to where slow, deep breaths, the type of breaths you would be doing in Qigong, Tai Chi, meditation. If any of you are fly fishermen, there's an article out just recently showing that the brain, when you're doing fly fishing, John, is the same. It reacts the same as if you are meditating or praying. So all of my friends who do fly fishing are obviously great meditators and prayer. So anything to calm and slow, not our heart in Chinese medicine, also slows our mind. Herbs, I still continue to say that jade screen is great. Most distributors are out of it. We've still got a couple of 100 bottles. You're welcome to pick one up, which that just reminded me. I had asked people if they would contribute money. The Chinese Acupuncture Clinic would match it, and we're delivering $1,000 worth of herbs at the cost that we pay for them, because we've received over $600 in donations, and we're matching that. So we're delivering over $1,000 worth of herbs to the Haywood Street Ministries, which the minister, it's a wonderful church. It really works with our difficult people with maybe lack of housing and sufficient food for now. So that will be happening, on Monday. Let's see. What herbs would you recommend for sour taste and chills? Well, a sour taste in the mouth, sometimes can be, bile, or it could end up being an imbalance of the liver. But I think if someone's having both chills and and sour taste, and if that's new, I would suggest you see an acupuncturist wherever you live. I know that there are a lot of people on this that don't live in this area, and if you can't do that, then find an acupuncturist that maybe is close to you who's doing online consultations. We're still open, but we do online consultations at our clinic. So it would be, from a Chinese medicine perspective, it would be hard for me to tell you what to take based on just a couple of things there. If there are no more questions, because I'm seeing this is not as much of a questioning group as before, I will say that what I decided to talk about next week, unless something strange happens, is I'm going to talk about feng shui, because so many people, are always asking a little bit about feng shui. And, over the years, I've studied feng shui a little bit, and I think it's an area that everybody's interested in. What do you do to basically create a healthy, healing environment in your house? And so I have to have a little PowerPoint or something to where I can point out some things, but I'm sure that there are people who can help me do that between now and next week. So next week at 7 o'clock, I'll talk about feng shui. and that means water and wind. And for those of you who don't know, it is the how do you promote your health, or how do you promote good family relationships, or how do you promote a good work environment for yourself. So those are things that we'll cover next week. And it was nice visiting with you again, and I hope you all have a good evening and a healthy week. Thank you. Any advice about happy wanderers? Yeah, the biggest thing in there is lots of focus on long, slow, deep breaths. Breathe in from your nose. Exhale through your mouth. Even before you go to bed at night, see if you can take 30 slow breaths and just concentrate on your breath. Now, if the last one you remember is breath number 6, don't beat yourself, but do 7 and go all the way up to 30 breaths of in through your nose, out through your mouth. That's the easiest way to become a free and easy wanderer, is focusing on your breath. Good night.